Ladies and gentlemen, my name is Sharon Whiteman. I'm part of the executive team at the Lyme Disease Association of Australia. We link arms and have been working for over 10 years now, since I think we're envisioned in about 2010 to make a difference for Australian Lyme and associated disease patients, current and future ones. It's been a big fight, as everybody knows, and this series is for our May Lyme month in 2022. And we're very privileged to have Dr. Nicola Ducharme with us today. Nicola is a licensed naturopathic doctor and is the founder and medical director of Restore Medicine. She is recognized as a Lyme expert internationally, and she has authored several books on the subject, including the best-selling The Lyme Diet, The Beginner's Guide to Lyme Disease in Australia, and Lyme Brain. I think I should read that one. She has also been a chapter contributor in 2 of Connie Strassum's books, Insights into Lyme Disease Treatment, 13 Lyme literate healthcare practitioners sharing their healing strategies, and New Paradigms in Lyme Disease Treatment, 10 top doctors reveal healing strategies that work. Dr. Nicola has developed 2 online training programs for Lyme disease, Lyme ED for patients and Lyme ED for practitioners, and they've been very popular in Australia for patients and practitioners alike. She consults with patients globally, blending conventional and integrative approaches to treating Lyme and other tick-borne illnesses. Dr. Nicola, thank you so much for being here today for all of the sick Australians.
You're so very welcome. It's great to be with you.
So let's go back to the beginning. You know, what caused you to be interested in Lyme? And, you know I read some of your background, and that you had a start to your career, your studies, and then you had a shift and you've never looked back.
Right. So, I mean, I actually trained as a naturopath in Australia, and then was spending time in the United States and really loved the United States. So I ended up staying here and doing my doctorate in naturopathic medicine, and went to Seattle for 4 years to do that training, and then moved to Southern California in 2003. And I was very fortunate when I went into practice to be kind of adopted, if you will, by a doctor, an osteopathic doctor who worked with autism. And so he was training me how to help these kids with the biomedical approach to autism. And then it turned out like the moms would come and see me and they'd say, okay, I'm 30 something years old, everything hurts, I have headaches, I'm exhausted. I thought it was just because I'd had a child and a special needs child, but this is ridiculous. Mm. And so, being trained in functional medicine, I would do workups of adrenals and hormones and toxicities like heavy metals. And so I started testing for Lyme disease and was shocked at how frequently it was coming up. And this was in Southern California, which is not sort of known as a Lyme endemic area. And so it just kind of naturally progressed from there. And at the time I thought, there's more and more docs doing this autism work, but very, very few where I was treating Lyme disease. And so I made the decision to shift gears a little bit and go more into the Lyme treatment. And then it's just kind of taken off from there.
And who's been your favorite mentors in the Lyme disease treatment world?
I did my ILADS, the International Lyme and Associated Disease Society. They have a practitioner training program. And so I did that under Steve Harris, who's up in Northern California. He is a wonderful doctor and a very great human being. So he really shared a lot of knowledge in the beginning. And then I did have a mentor here in San Diego. Her name was Dr. Teresa Yang. She's since retired. And I think she trained under Dr. Harris too. Mm. And so I worked with her for quite some time. We shared patients. And so they have been my 2 primary mentors. But, ILADS as an umbrella organization has provided a lot of training and conferences and lots of knowledge and information along the way.
Yeah, they're very progressive, aren't they? Well, I mean, I'm sure the science would be debated anywhere, but they're a gift to many people around the world.
Yeah, I remember my first ILADS conference probably in 2005. There was maybe 100 doctors there. And now, there's a couple of thousand. If you don't get registered, you might miss a spot. It's changed a lot.
Isn't that awesome? And something that we can dream about here in Australia for our future.
Yeah.
So, it is fraught with challenges and health policy denial. What helps you through the challenges with, in Australia, basically medical and health policies completely failing sick Australians or those with a tick bite or otherwise? What gets you through that kind of overwhelming challenge?
I think staying focused on the vision, the purpose. The purpose is the human being in front of me. It's not the overarching, like getting involved in the politics. Like there are people who get involved in the politics and we need those people. For me, I try and sort of keep the politics out of it, ironically, and just focus on, human life and well-being and wellness, and focus on the person, human being in front of me. And that's helped. It doesn't mean that I want to put blinkers on. I think it's important that we're aware and we're mindful. But my position is a clinical one. And so I really try and just kind of do anything I can do to serve that human, that individual, and not get so angry about the politics, because it would be easy to do that, but just really try to stay focused on how can I help? How can I help? How can I help?
Awesome. And being Australian born, you would probably have your own particular insight into the challenges here in Australia. What's unique about us from your perspective?
Well, it's so interesting and curious. Like, I mean, in the United States, there's clearly a huge faction of doctors and groups that certainly deny chronic Lyme. I mean, here when we're accepting of acute Lyme across the board, but the denial of chronic Lyme is still pervasive. But I think what's really stands out in Australia is just there is a group of doctors that acknowledges it and would like to work with it, but it's just the absolute lack of possibility, right? It's not even like in medicine and in science, there's, probable cause. There's like, it could be this, it could be that. We don't know for sure. We don't know it's not. What's a mystery to me is how quick the denial is and how pronounced the denial is when there's not even space for like, this may be the case. This may be causality. And so, the situation here in the United States is obviously sort of fairly bad, but, in Australia, it's just absolute blanket denial where there is evidence of Lyme. I mean, people who are testing positive on PCR tests who haven't left the country. Well, how do they think that's happening? They just call everything a false positive. Which is really, really quite corrupt.
It is corrupt too. And it's not scientific thinking, is it? Because science should always be questioned. It should always be open, and dialogue and discussion should be, primary. It should be foundational.
Yeah, 100%. And it's just that there's no even possibility when they aren't willing to have that dialogue. There's no possibility in their mind that this could be an infection found in Australia. This could be the cause of so many people's health issues, which we know, you and I know, and sick patients know. But Australia has been very, very stubborn in denying the whole situation.
There's so many disease pathologies that deserve to have stealth infections looked at as part of the etiology. Like they need to have that ruled out. And so many people here in Australia be with endless diagnoses that are getting treatment that's not targeted to the real cause of the illness.
Yeah, well, I mean, it turns out to be sort of Band-Aid treatment, right? Of like, you and I were talking a little bit before we started the interview about, medicine is so segregated now. Like the human body is divided into systems, and it's really tough. And that happens here as well, to have somebody that will, look at all the systems, look at the unit as a whole, and like treat the whole person. So, some of the tenets of naturopathic medicine, one is treat the whole person. We can't break people down into the nervous system, the endocrine system, the all of these different things. It just doesn't make sense because we work together. The body and all the different processes they're all connected. You can't just separate them like marbles on a table, And so I think that's one of the big issues, that, we don't look at people in terms of the totality. And, Lyme has always been called the great imitator, because it does mimic so many different things, and people have so many different diagnoses that don't speak to the underlying cause. And, sometimes symptom control, symptom relief, putting a Band-Aid, sometimes that's fine, it's not that that's bad or wrong. It's just that if that's all that's done, it's always going to have a limited benefit.
Absolutely. I think I was sharing in brief that, through our Lyme support program, we had the opportunity to help some individual patients for a couple of years as a trial. It was a trial program, and a lot of things worked about it, and there's things we tweak. But one of the things I really learned as a former ICU and emergency nurse is that even with multidisciplinary referrals, they try to pigeonhole them into a one system disease. There's no thinking around multi-system illness in Australia. So, I think we're going to be seeing the same thing with COVID patients, or we already are. And hopefully that, we want to give, I know the situation is very dire, but we'd like to also give some light at the end of the tunnel. And I believe that COVID and showing the multi-system problems that those long haul patients are having will start to progress research, and we can sort of piggyback on that eventually. Not that we're quitting fighting for real justice for us, but I'm hoping that will be. And Dr. Nicola, because of the entrenched situation here, I've had many doctors tell me that are international. We did a series of interviews about 2.5 years ago, saying that their referrals from Australian patients are seeing some of the sickest Lyme patients ever. What's your clinical experience?
Yeah, I don't disagree with that. I mean, I have consulted with patients in Australia over the years, and indeed done clinics with patients in Australia, and really tried to help to bridge the divide. Being that I'm Australian, but I'm trained in the US, and I've done what I can over the years to kind of bring some of that knowledge. And so I have seen Australian patients, as opposed to patients here in the US, and I do think that the Australian patients are some of the sickest, and it's because they've been unwell for so many years and is still not getting any help, still not getting that identification of, this is what you're dealing with. And this is where I think it's slightly, criminal. These people are dealing with this situation, and no one's even trying to figure out how to help, and those that do try to figure out how to help then get restricted or get, they're unable to treat patients or take those Lyme patients anymore. And so I think that's, part of the struggle is just, it's that Australian patients just can't get the treatment anywhere. In the United States, at least, okay, so there might not be a Lyme doc in every city. There might, people might have to travel. You might have to go to ILADs and look for someone who could be understanding and knowledgeable, but those people are out there. Whereas in Australia, the people who are knowledgeable, who do care, who want to make a difference, are then not being given the opportunity to in the allopathic medical community. And one of the things that I think is, that I would sort of encourage Australian patients is to look outside of sort of allopathic medicine, look at the naturopaths who are helping, look at more of the allied health professionals that may not be under the scrutiny that the MDs are under, but who might still have knowledge and information to share, and at least can provide support and help with some of the secondary effects. So for example, if somebody has a lot of joint pain, a lot of headaches, you may not be able to find a Lyme doc, but you might be able to find a naturopath who really knows inflammation well and who knows how to guide on diet and lifestyle factors. To be able to help, oneself as a patient, because I think the less help from the medical community, the more one has to be self-empowered and self-educated, and take the help where it's available. And I think that some of the more alternative health providers may be able to provide some of that help and support.
Absolutely, and so. If someone's either, we could have a whole range of people watching this. So someone either might just recently had a tick bite, the approach that you would recommend to someone who has discovered that tick-borne diseases might be underlying their chronic health condition. So for someone with just a tick bite who can't, right now, actually, it's health policy is that GPs can't treat a new tick bite patient. They have to refer to infectious diseases. So in a major city, that's 6 to 12 months waiting list. And regional, and they've got Buckley's to have access to infectious disease specialists. So if someone was bitten by a tick here and had a bullseye rash or a flu or some kind of, they've noticed a change in their health after that, what would your initial recommendation if they're really on their own? What can they do?
I mean, there are sort of herbal protocols and things that they could follow that may not be as potent as antibiotics, but would certainly be better than not doing anything. Even certain, essential oils on the bite site, But, some of the herbs that we use frequently in treatment of chronic Lyme can be used in acute Lyme, just, high doses and things like that. And that's where, naturopaths and people of that nature, herbalists, homeopaths could be really helpful there, because even if they don't understand Lyme, they know bacteria, they know infection, and so doing something like that, trying to be as aggressive as possible on a natural front would be better, in my view, than not treating at all.
Mm. I know somebody recently who had a sympathetic GP, and they ended up, getting a diagnosis of acne in order to get a script of doxycycline for a while,
Right.
So,
I didn't want to say that, but if there's something
I
else,
probably shouldn't, but
this is antibiotic.
This is war, isn't it? It's war. We're on the front line.
It's war. We got to do what we got to do.
Yeah, and so if someone, and then in the more chronic situation, so obviously, we've got your books, which are just a godsend for people because they can really walk through, but some people have difficulty reading and assimilating. So for people in a more complex and chronic situation, what would your recommendations be?
Well, that's kind of where the Lyme program came from. Not everyone can sit down and read and process. So the Lyme is it's an online program, online course. And so it has different components. It has like audio, so it's PowerPoint. It's so people can follow along visually, but if they can't do that, they can listen to the audio, they can download the audio. There are PDF summaries of every single module. And there's also some like how-to guides, like detox guides and Lyme diet guides and things like that. And so I kind of designed that for folks that do better with listening than they do with sitting down and reading a book. It's also broken down very clearly into modules and topics so that people can just reference back to little bits and pieces here and there, not have to get overwhelmed by this huge, big, listening course. But there's about 25 hours of recordings in there. So it's very, very comprehensive. It's essentially everything I know about Lyme disease kind of rolled into this program. So that is one option. And I also, when I was thinking about creating the practitioner one, I was thinking about practitioners in Australia and how important it would be to get this information to them. And not necessarily MDs, because I understand the politics and their limitations, but, like I said, allied health professionals that may be able to affect more change if they knew how to help. And so, all my protocols, the way I do things, the way I look at things, the way I look at lab testing, I teach all of it in the course. And so for the practitioners, it would at least get them to a point where they could help people, even if they're not experts in Lyme disease. And then for patients who really want to be educated and empowered, it's got a lot of information for them too. And the majority not antibiotics. There's one module out of 10 is antibiotics. The rest is herbs and detox and home therapies and diet and how people can help themselves, because at the end of the day, for the Aussies, that's what it's going to come down to.
Yeah, definitely in the short term, that's for sure.
Mm-hmm.
I'm sure science will progress, because I'm sure, well, that's everybody's prayer. So
it slightly has to, doesn't it?
Yeah,
they can't stick their head in the sand forever.
No, and the very foundation of science, true, good science, is to that continuing debate and questioning what we thought was true. And it always should be questioned. There always should be the opportunity to question the science.
Yeah, well, if the earth actually isn't flat, maybe there's Lyme disease in Australia.
Exactly. Absolutely. So what would you say to family members who, possibly have just their whole life trusted what the doctor says? They just can't imagine how health policy, they couldn't imagine the dark side of what we're experiencing here. What would you say to a family member whose loved one is questioning or thinking they have a tick-borne disease?
Well, the first thing I'd say is what they tell you, believe them. Please believe them, because I have found, and there's a little meme that I thought was so telling, and it said, chronic Lyme patients aren't pretending they're sick, they're actually pretending they're well. And I thought that was fitting, because a lot of people struggle to maintain, their regular life activities and chores and parenting and even working and things like that. But they may not look unwell on the outside, but they may feel like they're dying on the inside. And so, what I know for family members and friends is it's very hard to understand how someone who quote unquote looks relatively normal is experiencing as severe symptoms as they're describing. And it's so just so detrimental to their whole lifestyle. And so you've got family members having to pick up the slack on earnings or childcare or, all kinds of different things. So I think that I would encourage family members to get involved and again, be, how can I help? How can I help? And even just to be a listening ear. I mean, so many people just want to be listened to and want to be heard and want to be understood and not told they're crazy and not told that it's all in their mind and that they're just anxious and should, go take a nap or get on an antidepressant, just kind of really being that listening for people and that non-judgment, I think is such a gift that you can give your loved ones and friends and colleagues and just, to be there, to be the one person that doesn't doubt them or that doesn't downplay or discount what they're going through. I think is really huge. Because one thing I find with my patients, even here, is it's very contentious, even within families. And you know what? I find mold toxicity this way too. It's not just Lyme. Like I've had patients divorce over mold because one's saying it makes me sick, we've got to do something about their house, and the other saying, you're ridiculous, you look fine. We're not doing anything about the house. And, it comes to the point where it's really divisive. And, Lyme can be that way too, because you may have one person who's like, I can't do that. I can't cook dinner. I can't get a full-time job. And the other one might be, well, why not? You look fine. And so I think just really understanding that how people look does not equate with how they feel. And people can be struggling and hurting and, really, really having a tough time inside, but still trying to put on a happy face, still trying to be strong for other people. And so I just think, being the listening, being the non-judgmental person who's able to be in that space with that patient is the best thing that you could do for them.
Mm. And, looking from the outside, sometimes, and even though I had this experience as well, sometimes it's hard to accept yourself, to believe yourself. Like it took me ages to really believe, because
Right.
you have to stand up for yourself on such a deep level.
Well, it's so hard because, it's easy for me to sit here and say, well, Lyme patients need to be, educated and empowered. And some of them, like, I don't even know what my name is some days. Like, how can I be responsible for this? And, we would like to think that they can just hand that over to someone who they can trust, to someone who's got their best interests at heart, to someone that knows what they're doing. But that's just frankly not always a reality. Mm-hmm. And that's true anywhere, but I think especially in Australia for the lack of medical care and acknowledgement of this. So there's that fine line between, feeling like you're doing whatever you can for yourself versus, then judging oneself and feeling guilty that, you haven't done the diet perfectly, or that, am I doing enough? Or, is this going to be the rest of my life? That's one of the huge issues too, is just that mindset of, I can do this for right now if I have to, but if it's forever, I don't think I can. Yeah. And those are very valid feelings. Like it must be very, very frightening to be a Lyme patient in Australia, not knowing where to get the help, or not knowing what's going to happen down the road. But I think, it has to change. It has to, because it can't go on like this. And I think that, if anything, COVID and the pandemic was, awful for most of us. But I'm hoping that it does in some ways shift the paradigm, like shift how we see things, shift how we question things. And, COVID was brand new and it came sweeping in and no one knew what to do. And slightly was sort of, everyone made it up as they went along, but things have changed, things have come out of it. So my hope is that will then get applied to something like tick-borne illness. And there'll be, more open minds along the way.
Absolutely. And I think, like I mentioned before, the long haul COVID has shone a light on the chronic fatigue and ME/CFS community, and they're getting flow on benefits there. And this is just anecdotal, but probably half of the CFS and ME community have stealth infections. So that if they ever get that next step and actually test them, then they'd have real solutions for their situation, wouldn't they?
Yeah, absolutely. Well, I agree. I mean, most of my chronic fatigue patients who came in with diagnosis of chronic fatigue, fibromyalgia, whatever the case is, many of them turn out to be positive for Lyme. And at least give them an understanding. And I think one thing for Australian patients to recognize is, and I'm slightly saying this off the cuff, and I think I'm right in this, but it's still possible to get testing done through international labs. I mean, certainly IGenics will take samples from Australia. Almond Labs will take samples from Australia. So, if a patient wanted to get testing, and obviously it does need to be signed off on, by a doctor or a health practitioner, but that health practitioner does not need to be in Australia. And so even just in terms of like, is this something, it sounds like me, I think it's me, but is it me? Am I even barking up the right tree with this Lyme disease thing? Just getting some testing done, even at a distance, can be helpful in kind of assessing to at least know if this is something that's going on.
That's good advice. For Australian, Armin Labs don't need a doctor to approve. I think because Armin is an MD, I suspect that he's on staff.
Gotcha.
Which I don't think they have at IGenics. So
Correct,
we do plan a future talk just specifically on testing and understanding testing and and diagnosis. That that's a whole complex process in itself, isn't it? So we'll be covering that in future as well. So so someone was what two questions are coming to mind right now is that one of the things I've learned, or a medical opinion has been told to me, that sometimes treatment failure is when viruses aren't addressed. What's your comments and clinical experience on that?
Yeah, I would agree with that. I think treatment failures also occur when mold isn't addressed. I think that's another thing that can really get in the way. So yeah, I mean, I've always been of the view that some of the chronic viruses like cytomegalovirus, Epstein-Barr virus, HHV6, I typically see antibodies to those in my patients. But they're usually IgG, meaning it's either a previous exposure or like a memory cell. It could mean a chronic infection, but so my view is in most of my patients that the bacterial infections or the tick-borne infections are actually the dominant piece, and viruses are kind of like computer programs running in the background. But I do agree, if there's a lot of viral load, that can certainly get in the way. And those symptoms can mimic Lyme symptoms too. So that is something to look at. And that's something that's sort of not as difficult, that's not as challenging within Australia to look at those viral pieces. I mean, I think in Australia, what we need to do is figure out the pieces that can be assessed without such controversy and go after those. Like find someone, or a naturopath or an integrative medical doctor, a GP, whatever. Find someone who can explore some of these other things with you, heavy metals, viruses, mold, that aren't quite so contentious, but that often come up, certainly in my Lyme patients. And so take the treatment that you can get, right? Even if it's not the be all and end all everything, if it's a piece of the puzzle and you can get treatment for it, then I would encourage people to do that.
Anecdotally, in talking to patients over the last 10 years, I see some people respond only to antibiotics and some people only respond to a herbal approach. What's your experience with that, Nicola?
Yeah, I do agree with that. I have a lot of patients, like my primary kind of way to go is both together. The majority of my patients do antibiotic therapy at some point. I have some patients who are so sensitive to herbs, and I think part of this is like histamines and oxalates and things like that, that are more plant related, and then they get on antibiotics and they do fine, and I have other people that just can't tolerate antibiotics at all, and we do 100% herbs. So I've seen it both ways. part of it is, again, accessibility, it's sensitivity issues, it's drug allergies, there's so many different variations. But herbal medicine is so powerful and so supportive. And I just think, looking at the situation in Australia right now, that's where people should be looking, to more of the natural approaches, the herbal approaches, homeopathic approaches, detox protocols, things like that, that are a little bit sort of flying under the radar, if you will, of the more traditional medical societies.
Awesome. So with somebody, you've covered some of this, but we talked about what the priority solutions would be for patients in Australia. Is there anything that we haven't touched on that you'd like to add?
Let me think. I mean, I guess my primary message would be, look outside of allopathic medicine, look outside of Western medicine, because there's such a limited availability of Western medical docs and protocols and practitioners that are available to help. So look to your more traditional practitioners, the herbalists, the homeopaths, the nutritionists, and get whatever help you can get there. I used to think that it was sad that Australians had to fly to Europe or Cyprus or Germany or Mexico, whatever the case may be, to get these various treatments that weren't available in Australia. But at least it was an opportunity for some to get help. And then obviously, COVID and the pandemic probably put a big squelcher on that. So I do think that, I think if I were a Lyme patient in Australia, I'd be looking for a really good naturopath that, had some knowledge of tick-borne infections, that could offer some naturopathic support. Because I've had patients who've gotten well with herbal medicine. It's not that everyone has to have antibiotics. That's just not the case. So that would be my primary advice, would be, look at the more holistic practitioners who will look at you as a whole person, who will look for the underlying cause. And even if they can't test for Lyme or don't have, comprehensive knowledge of Lyme, at least to recognize the role of pathogens and chronic bacterial infections in the body.
Awesome. And what would you like to leave Australians with today in regards to going forward to a more healthy future?
Yeah, I mean, I feel like, just to have hope that the situation must change. It simply cannot stay this way. It simply cannot. And, as I watched the acknowledgement and the knowledge about Lyme growing over the years, it really was a grassroots movement. I mean, it wasn't coming from the government going, oh, we've got this new thing and people are sick and let's see what it is. It wasn't that. It was media, it was TV shows, it was, and people saying, oh my gosh, that looks like me. Oh my gosh, that sounds like me. And then kind of going from there. So I would say, just don't give up. Don't ever give up. And know that if you can't, get involved in that fight on that level, then there are people who will. And just, do what you can. Do what you can for yourself. Do what you can in terms of self-care. And above all, be kind to yourself. Just that self-love, that self-acceptance can be really, really hard, because you feel like your body's betrayed you and you feel like you're living in this, this person that's not actually you. And I've seen how hard that is, and how mentally challenging and spiritually challenging and, emotionally bankrupting that is. But just, be kind, give yourself grace, take care of yourself the best you can, lend an ear to someone else who is hurting. One of the best ways we can deal with our own pain is to be there to help somebody else. But just know that the situation has to change, and there are people working towards change. I mean, the Lyme Disease Association of Australia, I've known you guys for years, you work tirelessly for change. And this denial cannot go on forever. It simply cannot go on forever. So, my thought would be, just hang in there, know that there are people who will love you and support you and who are working on your behalf, and just never give up.
Mm-hmm. I had someone recently tell me that the big changes that's seen in the US in the last 5 years or so has been all about rich people and politicians getting affected personally, but someone in their family or themselves. by Lyme disease. So not trying to tell anybody, send ticks out to anyone in Australia.
Well, you wouldn't wish it on your worst enemy, right?
No,
And
would you? No.
if there was some, celebrity in Australia or something, I mean, I compare the whole chronic Lyme thing with HIV and AIDS, right? Back in the 80s, it was this new virus. No one knew what to do with it. It was threatening lives. But there were some celebrities. There was lots of research funding. There was lots of promotion. There was just all kinds of things happened. And as a result, now people are living with HIV. I mean, there is even drugs that have them testing negative. And, so that's what we need in the Lyme world.
Yeah.
We need those research dollars. We need the publicity. We need the celebrity backing, because sometimes that's the only way people pay attention.
Mm. Dr. Nicola, what would you like to leave people from your heart today?
I guess I just, you Aussies are very, very near and dear to my heart. I grew up in Australia, and my mom and sister are still in Sydney. And, I would do anything I could to help you. And I just want you to know that, there are people that care. And I, for one, am here for you. And if there's anything I can do to help, I am here for that. But just like I said, don't give up hope, and just, know that you deserve healing, know that you deserve to be heard, know that you are not crazy, and that what you're going through is very real, and there is a way out. Just stay hopeful, stay positive, and just look for the little things that you can do, right? All the little baby steps that add up.
Awesome, Dr. Nicola. Thank you so very much for being here today and sharing your heart and knowledge with current and future Lyme patients in Australia. And we'll make sure we'll put some of those links when we upload this recording, so you can access some of those resources to help you get going. So thanks everybody for your time, and we'll see you again with our next interview.
Thank you.